as a guy who's dealt with this, for a long time, kind of in layman's terms and easy to understand, an MCL strain, what that is and how that affects an athlete.
Well, the sprain of the medial collateral ligament is the primary restraint to the inside portion of the knee, not the middle, but the inside portion of the knee. So motion that affects weight shifting side to side requires the MCL to function at a maximum level. Obviously, the faster the motion, the higher the intensity, the more the MCL needs to work. And in a situation where it is injured, there's a variety of degrees that it can be injured, all of which leave the knee in a certain amount of disability.
When you hear an athlete has this kind of an injury, how hard, when you consider the sport of professional football and position of quarterback, how hard would it be to play on something like that?
Well, there's so many factors that go into that. Number one, did he have anything associated going into the game? Was there an injury he was battling? Does he have a history of problems? Now, I don't know the medical history of that knee, the surgical history of that knee. Did he have a college injury there? I mean, all those things play a role. And if the collateral ligament is injured, it can be a no doubt impossibility of returning in the severest of cases, and it can be an injury that, when it's mild, can allow for the athlete to perform. The question is where that stability is and what the training staff and orthopedic staff can do to support the knee. And I'm sure in this case you have some of the best professionals in the game supporting the Chicago Bears, and if that's the case, I'm sure they tried everything possible to get his knee supported and able to perform on it. And bottom line is, I don't think he could.
Is the risk when it's this kind of injury of injuring it worse if you continue to play on it and you take another hit, or if you twist it, or whatever may happen on a football field? Is there a possibility of injuring the knee more?
Sure. I mean, it is a primary restraint, and if that restraint is in some way, shape, or form compromised, then some other system within the knee has to pick up for the strain beyond what the primary can't check. And in that case, the cruciate ligaments become a possibility. The meniscus inside the knee, the cartilage of the knee, all become strained differently when that collateral is not there. And the factor is that when the ligament is acutely injured, the other part of that ligament is it gives feedback to the brain of where that joint is in space at all times. And again, that feedback is ultimately important the faster the level of movement is. So if that nervous system is disrupted, then the ability to tell where that joint is in space is also disrupted. And that is like a shockwave through the knee joint and through the body when it comes to athletic performance. I mean, it's very, very difficult when the acute injury is there to get the brain to accept your weight on that joint normal, because it immediately sees something wrong. And so you try to use some external support to provide some stability there, but even in a high-end level competitive environment, sometimes you just can't go.
As you mentioned, it's case-by-case basis, whether we had history in the knee,
right,
whether how, the grade to what the strain or sprain was. Is it something a guy can just, throw dirt on and tough it out kind of thing, or is that just...
I think he's getting a bad rap. I think it's very, very difficult in certain circumstances to be able to respond to that injury. And I'm sure a guy at his level, if he's got a competitive bone in his body, which he obviously does, there's no way he'll keep him off that field. And the brass tacks of it may have been as simple as the orthopedic surgeon looking at the laxity and saying, you're done. There's no way. Again, the severity really will dictate, and it may have not even been a chance. On the other hand, I'm sure they tried to brace him up, tape him up, and use everything possible, and he just probably couldn't accept weight on that leg. Not at any kind of intensity anyway.
When you play quarterback, you're throwing on it, you're running, you're cutting, you're avoiding 300-pound guys
right,
trying to dive at your legs. What does it actually do on the football field? How does it hinder your performance?
It's going to
pain.
It's going to be instability. It's a fact. There certainly will be pain, but when that joint is not stable and moves beyond its normal anatomical limits, the brain is going to shut things down, and you just can't accept weight crossing over that. It wouldn't matter. Obviously, skilled positions versus a lineman, there might be theoretically a little bit easier for a lineman to be taped up and to be able to move short distances, but again, one block down on a lineman's leg, they probably wouldn't be able to go either.